Good afternoon, madam.
Yes, sir. We request.
Good afternoon, ma'am.
Good afternoon, sir. We welcome.
Good afternoon, madam.
Yes, sir. Mute Panida. I think all of you can stay on mute. It's our real pleasure to invite all of you for our webinar. It's a pleasure to see so many participants on screen. We have a few of them on YouTube as well. Probably because of the connectivity issue, we may be recording the entire session and putting it on the YouTube as a recorded version, sir. Before we start the session, it's my proud privilege to introduce Dr. B.S. Santosh Khanna. Now, even before we start anything, usually for anything concerning physiotherapy, anything concerning NIPMED, anything concerning occupational therapy, we always tap him and ask, sir, this solunga sir, adu solunga sir, whether it is examination or BOS or anything with our curriculum. I thank you so much, sir, for that help that you've been giving us, and we'll still be troubling you for the rest of the years to come. As designation, he is HOD Physiotherapy, Principal, College of Physiotherapy, NIPMED. Qualification, he is an MPT, MSc Bioinformatics, MSc Yoga, PhD in Physiotherapy. The very apt person. He has been in this field for the past 2 decades from various capacities. This is the one which we say he has risen on a ladder, starting from a tutor up to the principal in the college. It's really nice of you, sir. And you are serving a disability sector for the past 15 years. I think you will be washing off all your karma, which all of us always want to do it. So I guess you're doing the best job ever possible, sir. He's serving as a principal investigator in disability related projects approved by Ministry of Social Justice and Empowerment, Government of India. And he's an expert committee member in disability rehabilitation in Rehabilitation Council of India. He serves as president of Faculty of Physiotherapy. He's a member standing academic board of studies. He's a coordinator for academic council. He's been trained in Singapore for motor activity training activities from Special Olympics International. He has many journals to his credit. He is certified assessor, auditor, and trainer in barrier-free environment and access audit conducted to various government institutions and trains many rehabilitation professionals on this audit barrier. I'm not very sure of what that means. That's why I had to read it. Anyway, a very warm welcome to you, sir. And his topic for today is addressing barriers. So that's exactly what he's going to address us on for person with disabilities, a physiotherapist perspective. And for discussion, we have Mr. B. Sendil Kumar, Principal, UCA College of Paramedical Sciences, Chennai, and Mrs. Subhashri, Principal, Mada College of Physiotherapy, Chennai. Welcome to both of you also. Sir, you can start your topic and you can give the floor over to them. Once everything is over, this can be open to the our participants or our attendees who are attending the seminar to question, and you can take up the question, sir. Is that all right, sir? Santosh Khanna, sir.
Yes, ma'am. That will be fine, ma'am.
Okay,
yes,
sir.
Am I audible?
Yes, you are. You can probably you can start your slides.
Yes, ma'am.
Over to you, sir.
It's my honor and privilege being part of this webinar, and I thank the Vice Chancellor, Madam, the Registrar, and the entire team of officials of Tamil Nadu Dr. M.G.R. Medical University who has given me this opportunity to proceed with this topic. Is it my voice clear and audible, ma'am? Can I proceed forward? So the today's person with disabilities perspective. So first of all, why we need to address this barriers for person with disabilities? It's a very simple and straightforward question, because we see persons with disabilities are a very small fragment actually in the entire
Excuse me, sir.
population
Excuse me,
of
sir.
persons are with disability.
Sir, F5 போடுங்களேன்,
Yes,
slide
ma'am.
show போட்டுருங்களேன்.
Ma'am, yeah, ma'am,
Slide
it's
show.
in slide.
No. This is on that slide. You see that, no, sir? That is coming. You make it in the whole slide. Put it as a slideshow.
Yes,
F5.
ma'am.
Yeah.
Ma'am, is that okay now?
Yeah, perfect. Perfect, sir. Wonderful.
So the question is why? So when because a person with disabilities are a small fragment of people who are present, maybe around some 2 to 2.5% percentage of the normal population are person with disabilities. So then why we need to focus them and focus a lot of things for person with disabilities, why we need to create so much of environment that is actually required for them. So because everyone may think that it may be a big financial loss when we are going to try to do so much on so much of things on that. But when we scientifically view this, even though the population is only some around 2.231 percentage, 2.231 percentage, when we compare the population of India, it is around 2.7 crores of people are with disabilities. So this is a big, amazing number. Why I'm saying this amazing number? When you are taking the entire globe, barring the first 50 countries, the remaining around 180 countries, the population of the 180 countries are much less than 2.7 crores. That means the population of Singapore, the population of Dubai or United Arab Emirates, Austria, any foreign nation who could finger out or just count across, their populations are much less than 2.7 crores. That means they are having much to contribute to this nation. Their potentials are being hidden because there are so much of barriers. There was a scientific study which was published by the World Bank, and they said when you are including person with disabilities in jobs and other traits, the GDP will be improved by 5 to 7 percentage. The same was again reiterated by the ILO, the International Labour Organization, saying that it will be around somewhere around 3 to 7 percentage. So you could see that our GDP could be improved by somewhere around 5 to 7 percentage when we are taking the contributions of persons with disabilities. Here we are not taking the contribution of person with disabilities because, and they are also not very comfortably able to contribute because of this barriers in the environment. So this barriers actually starts from the education, because I don't have a ramp, I don't have a accessible toilet, so I will not be able to go to the school. So what actually happens is they don't have a proper education, they don't have a proper job, a proper employment, and the entire essence of the career is getting disturbed because of an improper environment. I could say this environment is not proper. Because of this, so much of things are happening, and finally it becomes a liability of the government to take care of them. We are not able to make them a productive citizen. But if we are able to give them a proper environment, an accessible environment, they will also be a productive citizen for this nation, who will be contributing for the growth of the nation. So that's why, or that's we should have people with disabilities included in the mainstream. To include them to the mainstream, we should have the environment barrier free. So this is an act which all know that actually talks about the rights of persons with disabilities, called the RPWD Act 2016, which came into force on 28th December 2016. The important areas which I would like to focus across, why this act is all about, because it was an expression the government of India has given a commitment to the United Nations. In the United Nations, you call the UNCRPD, United Nations Convention for Rights of Persons with Disabilities. India has accepted it in the 13th December 2006 that they will be providing a decent livelihood and the rights of persons with disability will be upheld. Based on that, the government of India ratified the same on 1st October 2007, and the same thing has been passed as an act in Parliament on 27th December 2016 and came into force after the assent of the President on 19th April 2017. So, as per the rules of RPW Act was notified on 15th June 2017, the important clause in this is, as per Chapter 2, Clause 11, person with disability should be having an accessible voting. The Chapter 8, Clause 40 to 46 talks about accessibility for person with disabilities. So this is now a law, more of a law that we need to be following it. And the law actually emphasizes certain things. It emphasizes all public buildings to be accessible within 5 years of the implementation of the rule, and all websites to be accessible within 2 years from the notification of the rules. So why this is taking so much of importance is this came into force on 15th June 2017, and this is the 5th year. So this is the 75th year of India's independence, and it is also coinciding with the 5th year of the notification of the rule. That means by this time, all the buildings, all the government buildings are to be accessible for persons with disabilities. And Government of India, in full-fledged move, it is taking across, making all government buildings accessible with the something called as an Accessible India campaign, which is taking up in a big way. And after implementing of these rules, all building permissions and the licensing is all been given if the building is barrier free, new for the new buildings. So now coming core of the topic, what is a barrier free environment? A barrier free environment is a space that allows free and safe movement, function and access for all regardless of age, gender or condition, and a space or set of services that can be accessed by all without any obstacle, with dignity and with much of independence as possible. This is actually, we go as per the definition. So when we actually talk accessible environment, this is something that we come into line. This is actually called as the anthropometrics, where we as physios, as professionals, we look across. When we talk about anthropometry, we have something called as the static anthropometry and the functional anthropometry. Static anthropometry is when a person stands, what will be his height, length of hand, the head circumference. So when he sits on a wheelchair, what will all be the dimensions, so on and so forth, is called the static anthropometry. And the functional anthropometry is something when the person sits on a wheelchair, when he reaches out, how much he could reach, or what should be the distance, what should be the height, so on and so forth, is actually a functional anthropometry basis for this barrier-free environment. So the first slide, what we see is, and there was a marking saying from 90 to 120. What is all about? So this is something called as a common reach zone as per anthropometrics. So when a person is sitting on a wheelchair, he will be able to reach somewhere between 3 to 4 feet. That is from 90 centimeters to 150 centimeters. That is 3 to 5 feet. Same way, when a person is standing, he will be able to reach somewhere between 90 to 150 centimeters, again 3 to 5 feet. So anything that you could install within this zone, it will be useful for a person who is able to stand or a person who is able to sit. This is something called as a universal design. So universal design is not for person with disabilities, it is for all. So it should be in a position where everyone can use. Okay. This is again the structural anthropometry of a person sitting on a wheelchair. When a person is sitting on a wheelchair, what all his measures will be. So approximately the standard wheelchair, what we make, the length will be around 1200 millimeters. The arm rest will be at 760 millimeters. The handle will be at 920 millimeters. The footrest will be at 200 millimeters. Seat will be at 480 level will be at 1100 to 1300 millimeters, depending on the height of the person. these dimensions are so essential that we will be able to focus, design any kind of an equipment or any kind of a modification in a building that will be universally accessible. So this is again one more version of a person using a wheelchair. This is again something that we call as the functional anthropometry. That is, when a person uses a wheelchair, what will be the space allowance that is actually required. So when a person is sitting on a wheelchair, the minimum space that will be required for a person to comfortably sit on a wheelchair and turn to 90 degrees will be 5 feet by 5 feet. That is 1.5 meters by 1.5 meters. And if it is required for a person to turn 180 degrees, then it should be 1.5 meters by 1.7 meters. So that will be the dimension of a room or any space, a closed space for a wheelchair person to use. And if we want a person to turn 360 degrees, a complete turn, it should be of 6 feet or 1.8 meters. So this is the space allowance that is actually required. With this consideration only, as on date, we are designing a closed environment like lift and other equipments where it will be accessible for person with disabilities. If the lift is going to be so small, then it will not be accessible for person with disabilities. So this will be the minimum dimension that is actually required for any wheelchair user to turn with a wheelchair. This is all about a space allowance that is being required for a for person with disabilities using different kinds of assistive devices. For example, a person is using a stick, he should be requiring a space of 760 millimeters. If he's using 2 sticks, then it will be 800 millimeters. If the person is using an axillary elbow crutch, it will be 800 millimeters. If the person is using an axillary crutch, it will be 860 millimeters. A person using a tripod will be 900 millimeters. A person who is using a walker will be 800 millimeters. So on and so forth. For different kinds of aids and appliances, different space allowances are required. So when we take the barest minimum that will be useful for all, then we require a space of minimum 900 millimeters so that a person can walk with his aids and appliances along with a person can use a wheelchair. So why this dimension is again required? This is again a functional anthropometry. Why this is actually required is you will be designing the size of the doors, the size of the corridors, the size of the entries, the gap between the bollards. All other things can be designed based on this dimension. So it should be minimum 900 millimeters. So it will be accessible for all. Next is the vision zone. So this is something keeping on a notice board. When you are able to keep something on a notice board, you can see the figure out that a wheelchair user is there and a caregiver is helping him out. So both of them are seeing the notice board. So what will be the eye range? So we have said it should be somewhere from 1100 to 1300 millimeters. So we'll be keeping from 900 millimeters to 1200 millimeters. So it will be, and you'll have a mild tilt so that even a person using a wheelchair can see it comfortably, a mild tilt of 5 to 10 degrees. So this is the requirement when you want to keep a notice board. This is something on the vision board. Conventionally, when you are able to keep a big notice board, you start the height with 900 millimeters and go up to 1800 millimeters. The barest minimum, we need to start with 900 and it can go, because anything above 2 meters, it will not be comfortably viewed when person is sitting on a wheelchair. And coming to the important topic of accessibility, because when someone talks about accessibility, whenever you think about accessibility whatsoever, so the first thing that comes to our mind is nothing but a ramp. Ramp is a sign of an accessible environment. Even though it is not the toto of accessible environment, there are many things that needs to be addressed with an accessible environment, but a ramp is something that an important component of an accessible environment. So the first thing we need to understand is how a good ramp should be, because many a times I personally also faced in bus stands in many places that there was so much something called as a slope, which is not accessible for persons with disabilities. Even it will not be accessible for so-called normal people like us, because they put some slope which is so steep. If you are able to keep the foot on the slope, it actually slides out. So it will not be very comfortable. But when we think about a very good accessible ramp, then the first thing we'll think about the design consideration. So the design consideration is something, whether you say whether it is going to be a linear ramp, a 90-degree turn ramp, or a 180-degree turn ramp. What is the difference between these three? Linear ramp, you can adopt a linear ramp when you have more space. If you have half the space of it, you go with a 180-degree turn ramp. And still, if you have less space, you can go with 90-degree turn ramp. You may ask how? Because it's all a structure and design. When you're able to construct a building more of cubicle type, uh, then you can move the ramp around the building. So it will not be taking more than 6 to 10 feet than the structure of the building. So if you have very less space, then we think of going for a 90-degree turn ramp. So these are something called as a design consideration. The next important thing, what is important when you want to have a ramp, is the inclination. We had guidelines which was from 2005, and we have the recent guidelines which is something on 2016 harmonized guidelines. Before 2005, they say the ramp inclination should be 1:12. Once it came when we had the harmonized guidelines, then they why? Because this is again
Sir, your presentation. So your presentation and your voice, we're not able to hear you, sir. So we're not able to hear you. அடிக்கிறேங்க ஒரு நம்பர் தான் இருக்குன்னு நினைக்கிறேன் இல்ல ஒரு நம்பர் தான் இருக்காங்க ட்ரை பண்றியா YouTube recording
temporary beach pathway for the disabled to reach the waters at Marina, and even floating wheelchair was introduced to make the disabled experience floating in the waters of Marina. So these are the various features introduced. Thus, in future also, we must create an environment which is barrier-free and make those disabled persons experience what they thought was impossible.
Very nice to hear this, sir, because they should also know that they can be a part of the recreation. It's not that they just need to carry on their daily activities. It's very interesting. I think Dr. Santosh Khanna was back.
I can, shall I hand over the session to him, ma'am?
He is again out again, sir. I don't know.
I can show some pictures of these.
1 minute, Dr. Santosh, are you in? Yes. Santosh, sir?
Madam, am I audible?
Yes, yes, you are. You are. Please continue, sir.
Hello?
Yes, sir, you are audible. Please
Madam,
continue.
am I audible? Yes,
yes, sir. Yes, yes, please continue.
Yes, ma'am. Yes, ma'am. Thank you, ma'am. Thank you. Thank you, ma'am. Yeah, yes, ma'am. So, sorry for the trouble. It was a technical snag in between. We are actually discussing something called as the design consideration, the linear one, the 180-degree turn ramp and the 90-degree turn ramp. Apart from it, what is very important is the inclination of the ramp. Why inclination of the ramp? Because earlier I was saying that from before 2005, it was 1:12. The ratio was given. The recommended ratio was 1:12, and now they have been changed into 1:15. So who has made the change and why the change is all about? Because these guidelines is also being updated with the experience of person with disabilities and the professionals. Because when you are maneuvering through the ramp, you get strain of your muscle gets fatigue. So you will not be able to move beyond an gradient. So these points are also taken into consideration when the rules and the guidelines are being revised. So again, I would like to bring to the notice of all the esteemed audience here that this is again a professional role where we will be giving our inputs so that the guidelines will be modified accordingly. It has been modified in 2016 called as the harmonized guidelines. So as per the harmonized guidelines, the gradient of the ramp should be 1:15 if the height is going to be more than 750 millimeters. That's one thing. Second thing is, for every 9-meter run, there should be a level gradient or a flat area where the person can stand with their wheelchair and take some rest. So you'll be moving for 9 meters and then you'll have a rest, and you'll be moving for every 9 meters and you can take a rest. So that is a resting area, so that you need not completely move across for the entire flight. So in between, if you are getting fatigue, then it will be difficult for the person with disabilities to maneuver beyond. So that's one thing about the gradient. Next is, along with the gradient, we also have the size of the ramp. So what should be the width of the ramp, for example? So normally we say minimum 900 millimeters is actually required. The minimum 900 millimeters is actually required for a ramp. So, but if you are using a 900 millimeter ramp, only one person can move across. If opposite one person comes, then he has to stand till the person moves the entire flight. So the advisable is, if it is going to be 1800 millimeters, a 6 feet ramp is an advisable size of a ramp. But we think we have some kind of a space constraint, then we can go with 1200 millimeter ramp or 1500 millimeter width or 1800. With 1200, a person with wheelchair can move across, and opposite one person can cross it. A normal abled person can cross. If it is a 1500 millimeter ramp, a person with wheelchair can maneuver. Opposite, a person who is using an assisted devices can cross. And if you are using a 1800 millimeter ramp, then both opposite two wheelchairs can be maneuvered. So this will be the size consideration or width of the ramp. Along with that, we also give them the railings. So what all should be the railings? Railings basically at two levels. Basically, one at 750 millimeters, another at 900 millimeters. 750 millimeters is for the wheelchair users and the pediatrics. And for ambulant people, it will be 900 millimeters. Apart from it, we also have one small curb at 150 millimeters or a small railing that is for people who are visually challenged. People who are visually challenged use something called as a white cane for using railing so that they don't hit somewhere. So these are the railings that is actually dimension of the railing. It should be somewhere around the diameter. It should be of a dia of 40 millimeters. 40 to 45 millimeter should be the diameter of the railing. So it will be easy for people to hold, including the pediatric. So this is the requirement of a railing. So apart from it, what all things should be there in the ramp for a good ramp? The flooring should be an anti-skid flooring. An anti-skid flooring in the sense it should have a coefficient of friction anywhere between 0.8 and above, so that it will not skid. We have coefficient of friction, something called as a dry area coefficient of friction and wet area coefficient of friction. When you are putting a ramp in watery areas, you should apply wet area coefficient of friction that will be more than 1.5. And when you are using in a normal area, a closed covered area, we have a dry area coefficient of friction which can be 0.8 and above. So apart from it, we have something called as the tile. Tile is something called as, we have two types of tile. Internationally, we have three types of tiles, which is called a guiding tile, a warning tile, and a alerting tile. But international India, we use in India, we use something called as only two, a guiding tile and a warning tile. Guiding tile is to guide a person to move in a direction, and warning tile is to say something that you have a level difference. So when you are taking all those components into consideration, then we are able to build a good ramp. So it is just, the building is an engineer's part, but the component requirement will be more of a professional part of a rehab professional and a physiotherapist who will be able to give them guidance on how things could move across. So this picture actually we see can be there. If it is 1:20 or more than 1:20, it is easy. If it is 1:10, you require assistance to move across. And if it is more than 1:10 or less than 1:10, the gradient, then you say it is hazardous. People cannot maneuver through it. And this picture talks about initially the first slides I would have spoke about the anthropometry. This is again a lift area because that is actually applicable here. So when a lift is being designed, how it should be. So when you are having a lift, basically the entrance should be somewhere not less than 0.8 meters or 800 millimeters. The length should be 1.3 meters and width should be 1 meter, the minimum size of a lift where a wheelchair user can enter into the lift. And in small lifts, we have something called as what you call a mirror. Usually, in many of the situations, we would have seen that mirrors are present in the lift. But if anyone have thought what will be the application of a mirror in a lift? Yes, it has a very accessible application, because in a small lift, when the person with the wheelchair enters into it, he will not be in a position to turn. So this mirror gives a visual feedback so that he can enter into the lift and he can reverse it out without anyone's support. So that is actually the practical application of a mirror in the lift. Same way, what we see here is a stair. It's not only the ramp that is actually required to be accessible, it is also the stair that is also can be made accessible if certain kinds of basic features are being incorporated into it. Same way like a ramp, what are some basic features, if we are able to incorporate in the stairs, it all becomes accessible. The one important component of a stair, because apart from wheelchair users, other persons with disabilities can also use a stair. For example, a caliper user, a prosthetic user, a visually challenged person. So they can very well use a stair. So to make a stair accessible, two things that is very important. The riser should be of even size. The riser should be of even size. The riser is the height of the stair. So the recommended size of a riser is somewhere from 150 millimeters or 15 centimeters. It should be, and it should be even throughout the entire building. So that even a visually challenged person is walking on the stair, he can comfortably able to maneuver, because if the size variation actually happens, he may trip and fall down. So that's very important. The riser should be of 150 millimeters, a maximum of 150 millimeters. It can be less also, but should not be more than that. And next is the tread. The tread is the area where you keep the foot. The size of the tread should be minimum 300 millimeters. That is 1 foot. So the riser should be a maximum of 150 millimeters and tread should be minimum of 300 millimeters, so that a person can comfortably land. And in many stairs, we would have seen that something on the tip of the stair, you have something called as a nose will be present. And in this figure, we'll be able to appreciate this. This is called as a nose. A nose is a projection. Usually for barrier-free guidelines, there should not be any nose. It should not be there. It should be flat. If at all you want, it cannot be more than 0.5 centimeters. If it is more than 0.5 centimeters, that it will actually trip across and the person will fall. And in case if you are going to have a bigger stair, a more wider stair, and then you need to give an intermittent railing. Railing should be on both the sides. And if you are seeing a stair going to be around 15 feet, 12 feet, 20 feet, in that case, we need to have one railing in between, so that it will be comfortable for a person to maneuver. These are the guidelines that is actually required. This space allowances, we already seen in the first functional anthropometry that how much space is actually required for a wheelchair user. So this is when a wheelchair user is entering a room or a lift, the minimum space we say 900 millimeters is comfortable, but minimum 815 should be there, because then only the wheelchair can go, or else it will be very difficult for the wheelchair to move across in any passages. This is the wheelchair turning space, which we have already discussed earlier. For 2 wheelchairs to pass, the size of the corridor should be somewhere around 1800 millimeters, which we have earlier discussed. Coming into the very important area, the slip resistance, the floor surfaces. When we are discussing about the ramp, we just thought about it. When you are walking on a floor, the very essential component is the coefficient of friction. The coefficient of friction is very less, we may trip across. So here we have something called as a dry area coefficient of friction and a wet area coefficient of friction. A dry area coefficient of friction is in a normal area, a covered area, and the wet area of coefficient of friction will be somewhere on in washrooms, swimming pools, and area in and around where the person will be drenched and walk across. So dry area of coefficient of friction should be somewhere around 0.8 and above. Wet area can be 1.5 and above, so on and so forth. So when the friction is more, the chances of person tripping across will be very. So this is something called as a TGSI, the tactile ground surface indicator. What we see here is called the warning tile. A warning tile is a tile which warns a person that there is going to be a level difference or a directional change. A level difference or a directional change. And a guiding tile is a tile will be saying that this is the direction that you need to walk. So when a person is walking on a guiding tile, he'll be able to feel from the foot that this is the direction. This is basically used for people who are visually challenged. And for this also we have certain specification. The warning tile, you have a dot. You can appreciate there are many dots into it. So the lower end of the dot, the circumference should be around 35 millimeters, and the top end should be around 25 millimeters. It's something like a cut cone shape. So this is how it is the advocated size of a warning tile, which is used all over India. These are different types of TGSI, the tactile ground surface indicator that we could see. This is something called as a hello. Next, you see the what we see is the anti-slip surface. Anti-slip surfaces are surfaces which will be stuck across ramps, step, curb ramps, and any of those areas. So the basic guideline for a step is it should be of 50 millimeters width, and it should be at the edge of the stairs. Why it should be there? Because many of the times we would have experienced this situation when we are drenched in the rain, and suddenly when you want to climb the stairs, you just keep the foot on the stairs and you slip and you fall down. Or at least we tend to fall is somehow balance and manage. Why this is happening? At the tip, when you don't have a proper coefficient of friction, the foot trips across. So to avoid this, we have strips which are anti-slippery in nature. These are anti-slippery strips which we have to fit across the stairs. These structures which we see is something called as the bollards. Bollards are structures that is present in the walkways, in the pavements, to avoid vehicle entering into it. But many a times what we see is we keep the bollards so close to each other so that it will not be accessible for a person with disabilities. When a wheelchair person comes, he will not be able to move across. So what he will do is he will be moving on the roads, but he is supposed to move on the pavement. So the minimum width that is actually required between each and every bollard should be minimum of 900 millimeters so that a wheelchair person can access through it. We have static and dynamic bollards. We would have seen in hospitals also these bollards. You keep the dynamic bollard over there so that the vehicle cannot enter that area. But once the ambulance comes, they switch on the button and the bollards go down, and only the ambulance will be entering it. So this is a dynamic mechanical bollard. Whatever is available and whatever is as per the requirement, we will be able to use the bollard, but the specification, accessible specification is actually required. Next, what we see is called the gratings. Gratings are structures which we keep it on the culverts, water drain areas. So this is actually required to the specific dimension. The space between each grating or the gap area should not be more than half an inch or 13 millimeters. And it should be perpendicular to the direction of passage. Why this is actually required is when you are using a wheelchair, in the front end, you have something called as a casters. So if the casters get struck into these gratings, then the wheelchair cannot propel forward. And when we try to move it, the wheelchair trips on and you fall down. So to avoid certain inconvenience, the gratings are present on the opposite direction, that is perpendicular to the direction of travel, and the width should also be less than half an inch so that the casters did not get struck into it. So this is the picture which we will be depicting how a grating should be there. The person wheelchair user is moving forward and the grating is perpendicular in the direction and more than the width is also around half an inch. Next is the doors. So how an accessible door should be. Usually we advocate door should be of sliding in nature. A sliding door is easy to handle. In case we are not in a position to provide a sliding door because of some limitation, then we go for a hinge door. The hinge door is a normal door. You basically have a single leaf door or a double leaf door. If you are using a double leaf door, it is always advocated that one door should be bigger, that is more than 900 millimeters. So because many a times we always not use both the doors, we use a single door, so the wheelchair person can use. If it is going to be 1500 millimeters and you keep 750 millimeters one door, many a times you need to open both the doors. So we have one big door and one small door, so it will be used for a person using a wheelchair as per accessible guidelines. And when you are using a door, we always think of an automatic closure. This automatic closure should also be of 22 Newton pressure. Anything more than that, it will be difficult for a wheelchair user or a person with disability to open. So um, this pressure that is required or the energy that is required should be of 22 newtons or less than that. So that is the guideline. And in a door, we also have something called as a kick plates. What is a kick plate? Is a area where the person can kick open the door. So that has also been present. So that is also required. So these are the accessible features that is actually required to be kept in a door so that it will be accessible for person with disabilities. So this we have already seen. How a handrail should be there, what are the different dimensions of a handrail. One essential point that we need to think across is the railing should start at least 1 feet before the ramp or the stair. Because in conventional practice, because even in physiotherapy, we see first you keep your hand and then keep your foot. So if the railing starts exactly at the stair, then the person will be difficult to keep his foot because he will not have any hold. So we always say first the railing should be extended at least 1 feet before the level difference so that you hold the railing and you can move forward. So these are design considerations, how a wheelchair user uses a pathway, a ramp, and a person using a visually challenged person using a white cane. Next, what we see is something called as a grab bars. Grab bars are structures that is usually present in the washrooms. So this is you have different kinds of grab bar, a horizontal grab bar, a vertical grab bar, a wave type grab bar. Depend on the requirement, we fit it across the washrooms and other areas so that the person can hold it and maneuver within the washroom area. So what we see is again a wave type grab bar, horizontally fitted. This is something called as an horizontal bar, which is again put across in the washrooms. This is a wheelchair accessible washroom. A wheelchair accessible washroom. So a person will enters the area and you'll be having all the fitments, the grab bars, the vertical grab bars, the horizontal grab bars, the area where he can rest him across for his requirements. So this is the space allowance that is actually required to construct a washroom. So earlier guidelines says it would be around 2000 millimeters to 1000 by 1700 millimeters. But the recent guidelines after the harmonized guidelines 2016 says it should be of 2000 millimeters by 2200 millimeters. If you're having 2000 millimeters by 2200 millimeters, then you will be having a minimum of 1500 millimeters in center so that the wheelchair can turn across. So this is the space allowance to construct an accessible washroom. This is a very important area for a therapist, how to maneuver into a washroom. Where this is a thing that it's called a parallel approach. This is called as a diagonal approach. And this is also a diagonal approach. But different kinds of approaches, different person with disability works across, and the therapist who trains them also trains in case if it is going to be an acquired kind of a disability or spinal cord injury in the initial phases, the therapist also trains them. But what we need to understand here is the design consideration. In case the closet is being present in front of the door, exactly on the front of the door, it will be like this. I'm just keeping my cursor and showing. So he'll be able to move exactly opposite to it. So he will not have the space. So it will be very difficult for him to maneuver or move across from the wheelchair to the closet. So if you are having some space, then the person can move on the sides and he can transfer. The easiest way is something called as a parallel approach. For this, how we need to place the door and the closet is the door and the closet should be as a diagonal fashion. So that once you enter the door in the reverse direction, you will be placing yourself parallel to the closet and you can have a shift. So this is how that the therapist and other rehab professionals will be able to guide the engineer how you need to construct a washroom. Because we have seen many projects in Sarva Shiksha Abhiyan where they construct ramps and washrooms. Certain kinds of challenges person with disability faces because of the design consideration is not as appropriate as it should be. And this is a model washroom which we see here. A model washroom having a grab bar. This is a vertical grab bar. This is a horizontal grab bar. It's a swivel grab bar where you can move across. So, and in case of a wash basin, you will have a better leg space. I call the leg room so that the person with wheelchair can move across without any difficulty using the wash basin. What we see here is an area called as a donning and a doffing area. A donning and a doffing area is an area that is present before the washroom where a person uses a wheelchair or a prosthetic user comes across, sits in this place, removes his caliper, removes his prosthesis, and then move across to the wash area. So this area is called as a donning and a doffing area. And the donning and doffing area should also have a seat and with requisite grab bars, the vertical and the horizontal grab bars. Next, what we are seeing is the signages. So we all know the signages gives an idea what is actually present over there. Usually we have different kinds of signages that is present. We have something called as a numerical signage, pictorial or pictorial signages, alpha signages, so on and so forth. But when we think what would be the proper kind of a signage, they say alpha iconic signage. Alpha iconic signage is being considered to be as the best type of signage because the icon present will be useful for person who are not able to read. An illiterate person will also know what it is. And the alpha numerical, so it will be of words also, letters also, that will be useful for person who will be able to read. And one more advancement is this signages can be on brailles also, and it will also be in razors where the person can touch and feel what is across. So when these features are already present, then we say it is a good signage. So these are examples of a signage. Usually we have the background. Usually for a good signage, they say the background should be of blue and the writing should be of white, or background should be of white and the writing should be of red. So why it is this? The color should be contrasted. When you have a color contrast, it is easy to see. But usually we say white on blue or blue on white is a good contrast because it is easily readable for person with disabilities, even at a long distance. Red is also good, but red is usually used in areas where you need to have some kind of alerting. So signages will be of different sizes and measures. For example, we can have something called as an hanging signage. Hanging signage should be of 2 meters and above so that it don't hit a person's head. A static signage, the maximum height can be of 2 meters only because on a sitting, it will be easy for the person to view. We have different kind of signages which can be fixed across on the doors, rails, so on and so forth. In case of signages which are able to touch and feel, it is preferable that it should be of braille embossments to it so that it will be read by person with visually impairments also. So these are certain basic guidelines that is actually required to keep the environment barrier free. And this barrier free component is an expression of the anthropometrics of a structural and a functional anthropometry. And we have a bigger role as professionals, as therapists, to be playing across into it. And why I would like to bring out this topic is because this is the 5th year of implementation, as I said initially, of implementation of the RPWD guidelines. So this year we are expecting all the buildings, all the government buildings to be accessible. And we have many initiatives like the Accessible India campaign and many initiatives taken by the government of India, and government of India is also taking a very sincere step to correct the buildings which are not accessible. So as professionals, when we are able to assess all our buildings and say this is not proper, we give them the guidelines. This will also be taken into account for further corrections and for furtherance of the efforts that government takes across. Thank you all, and thank you so much.
Thank you so much, sir. That was very extensive and lucid presentation. Now I call Mr. B. Sendil Kumar, sir, to add on if anything is more.
Good afternoon, ma'am. It was an awesome presentation by Dr. Santosh. No doubt he's a wonderful orator. This session was very much informative, not only for physiotherapists, but also for common public and architects. As I was telling earlier, our Chennai Corporation recently launched a temporary beach pathway for the disabled to reach the waters at Marina. I'll show the pictures.
Can do the screen sharing, sir.
I'll start this screen sharing. Ma'am. Is my screen visible, ma'am?
Yes, sir, but join the Zoom community, only that portion is seen.
Now, ma'am?
No, sir, still I'm not able to see the presentation.
Is it?
Yes, sir. Yes, sir. Now it's done.
So recently, our Chennai Corporation launched this temporary beach pathway for the disabled person to reach the waters at Marina.
Is it functional now?
I think it's open, but it's not in full function. It was launched, but not fully functional.
Functional.
And this is the picture of a floating wheelchair where the.
So we are not able to see the picture, only the folders are seen.
No, ma'am?
No, sir. No.
No, ma'am?
Yes, sir. Now is it okay?
So this is that pathway.
Okay.
Where the wheelchair can go up to the water.
Oh.
So this is the picture of a wheelchair going up to the water level. And this is the picture of
pathway.
And this is the picture of floating wheelchair, where the disabled person can experience the floating in waters of Marina.
Yes, sir.
So thus in future, also we must create an environment in which is barrier free and make those disabled person experience what they thought was impossible in their life.
Life. Definitely, sir. Very nice to see those pictures. Even though I have seen and heard it in the newspaper and the news, but actually this is the first time I'm seeing. It's very nice.
Okay, ma'am. Can I hand over the session to?
Yes, sir. Mrs. Subhashri, ma'am, are you there in the meeting? Subhashri, ma'am. Principal, Mada College of Physiotherapy. Subhashri, ma'am, are you there?
Yes, ma'am.
Yes, ma'am.
Yes, ma'am. Good afternoon, everyone. I thank Vice Chancellor, Registrar, and all the officials of the Tamil Nadu Dr. M.G.R. Medical University for giving me this opportunity. I'm honored to be here to share my clinical experience about the individuals with disability. Of course, I have spoken regarding the architectural barriers, the environment space, modifications and all. And I'm sharing my clinical experiences with the person dealing with the cases of disabilities and how we made modifications in the environment. I'm saying about my clinical experience. I once met with a person who had a history of limb heaviness and not able to lift the limb, and she dragged the limb while he walking. It was all of a sudden to her. And she went to the hospital where they found that they had a paralysis of both the limbs, and immediately she was admitted in the ICU for her treatment. Of course, there are a lot of treatments is going on. As a physiotherapist, we saw in the intensive care unit, we have provided a techniques of treatments to her. And after that, to the maximum treatments is what we provided to make them to be in the wheelchair for a short period. Where at the times as we went to her home and found that we assessed the areas as about the floors and doors and the entry point of the home, as well as what are the modifications we can make in the environment for her to move freely within the home environment. That's what we did as a treatment for her. We made the changes in the floor, as well as we changed the width of the doors, and we made some modifications in bathrooms and we have advised them to fit some handrails over there. That way she can able to move freely in the environment. It increases her confidence level. Followed by that, she can able to cooperate with our treatments of increasing the limb strength. Gradually, she started moving the limbs. And after that, we moved toward that of your, as Sam said, it is a canes, a simple minimal support of a sticks. She can able to come up with the walking. So this is a clinical experience what we made with the architectural barriers, though it is going to be designed and it is explained by this. We did it as a part of the physiotherapy treatment for a case, and we have succeeded out of that also. In short, I would say disability awareness through physiotherapy field techniques helps to improve the functional ability of the disabled individuals and does make a huge difference in the society for the same. So Sir is discussing about the physical barriers, and as well as he is talking about the architectural designs, whatever we can make in the anthropometry. Adding to his points, I would like to say something. Barriers are there in the environment, especially we divide the environment into two. Inside the home, we have to evaluate the areas. What are the modifications we have to do for the patient to move freely, as well as we have to look into the outer spaces. What are the changes which makes them to be easy and move freely in the surrounding areas also. So basically, the modification should be done initially in the home environment, and after that, it has to be done in the outer spaces also. Especially, we make the people to be free to reach for the things as well as access to any areas, as well as they feel independent in all the areas, in all the activities. Then only they'll be happy and their treatment is going to get fulfilled. This has been taken into consider from every physiotherapist point of view. So it is creating a barrier-free environment, not only changing the environment, but also change the attitude of the people towards the children with disability. That also has to be changed. And Sir is talking about the barriers. The most important thing I emphasize this time is lack of knowledge and skills is all there in most of the people is about the disabilities. So people has to support the people with the disabilities is by knowing what they can do, what is the extraordinary challenge lies in them, how we can help to them. These are the ways as we help the people is to bring to the better peoples in the environment. And basically when you're talking about Saras from the pediatric setups, and he knows everything well, but still I would like to say, add a point that the peoples with a special need, especially when you're talking about these children, find out the ability of the children. As you change the environment alone will not going to help. The ability what lies in the children's has to be supported by the caretakers or by the physiotherapists, so that their confidence level increases as well as they will shine in the society.
Thank you very much, madam, for your inputs. If there are any questions in the audience, the floor is open. Other participants or any students who wanted to raise some questions. So there are no further questions. Now we can officially close the session. I thank Dr. Santosh Khanna, sir. Yes, sir.
Madam, like I would like to have one more point on this.
Please,
This is
please,
for the
sir.
public information.
Yes,
We have something called as a Sugamya Bharat app that has been developed by the Ministry of Social Justice and Empowerment, Government of India. This app can be downloaded in any Android mobile. And in case some area is having some barriers, you can click a photograph and send it. So that will be taken into consideration and the ministry follows up so that it can be rectified. So it is a crowdsourcing app which has been developed by the Government of India so that for effective implementation of barrier-free environment. That is one point. And
yes, sir. Can you just repeat the app's name once again, sir?
It's Sugamya Bharat app, madam. Sugamya Bharat.
Yes, sir. Noted.
And one more thing, it was a very vital point that was brought to notice by the principal of Mada College, Subhashri Madam, that the environment, we need to take into confidence the environment, the internal environment as well as the external environment. That is what actually we do something called as an access audit. Access audit is to evaluate the spaces, the internal spaces and the external spaces, and we will be telling what all the lacunas that is actually present in the building. So what all modifications that we do in the inside the building and outside the building so that it can be accessible for person with disabilities. As on date, we have done many access audits for many of the institutions so that based on the guidelines, there will be some revision on the structure so that it can be made, the building can be made accessible. So these are 2 points I thought I will bring it to the notice of the August gathering here. Thank you, ma'am. Thank you for this opportunity.
Yes, sir. So there is one question in the chat box. What are the future scope of physiotherapy role in disabilities? This question is raised by Mr. Vijay. And he's also asking what are the challenges faced while physiotherapy rehabilitation on disabilities? What physiotherapists need to consider on that? Sir? Am I audible? So there are 2 questions in the chat box. Dr. Santosh Khanna, sir?
Madam, am I audible?
Now only it's... Yes, sir.
Sorry,
yes,
ma'am. I believe there was some connected. Yeah, I'm trying to answer the first question. Disability rehabilitation, you have a length and breadth of things to be taken into consideration. More focus to this topic. Why I want to bring this topic is we study a component of this in our rehabilitation medicine. But if there is a revision of curriculum including these topics, all the physiotherapists could be as access auditors, because we are the people who actually work across with person with disabilities. As madam said, we need to understand the abilities also. So people who are with disabled persons with disabilities will be able to formulate the guidelines. The guidelines which has been formulated in 2005 has been revised in 2016 by professional inputs given by doctors and therapists, so that this could also be changed. So this is one way how you can be a policy maker. Apart from it, scope of disability rehabilitation, you have length and breadth, because disability area now is being more focused across. Many disabilities earlier they thought they don't have anything to do. Now we are giving them a wider coverage from womb to tomb. So the early intervention takes a major seat, because as all professionals we all know that whenever we are giving any kind of a stimulation from 0 to 2 years, when the brain is not much myelinated, the development is much higher. So again, I would like to bring this again, the reference to Government of India. Because of this concept only, Government of India, all across India, they have started 14 early intervention centers, which primarily focus on early intervention needs of persons with disabilities. Ma'am, may I go with the second question?
Yes, sir. Please, sir.
The second question I'm not able to hear, ma'am. Please, can you please repeat the second question?
What are the challenges faced while physiotherapy rehabilitation on disabilities? What physiotherapists need to consider on that?
Predominantly, challenges is interpersonal, ma'am. We need to understand a person with disabilities, because when we are handling physical disabilities, it will be different. When you are handling intellectual disabilities or mental disabilities, it will be completely different. For example, when you are handling a child with autism, you need to keep your temperament so low, and you need to understand the child in a very better way, so that the treatment could be better. If we think the child, suddenly the child will come and push you, pull you, hit you also at many a times. What therapist thinks, if we are not able to understand the disability condition, then it becomes a challenge. So one more important thing is taking parents as a co-therapist, because the therapist handles the child for half an hour or 1 hour, but the parents takes care of the child for the entire day, more than 23 hours remaining time. So they should also be trained with some kind of skill sets, which they will be able to implement them at home. So by doing this, we can have an effective outcome that we could make across.
Definitely.
And I believe the curriculum should also be revised for adequate inputs on disability, which our university is effectively doing.
Excuse me, ma'am. Shall I talk something? I'm Subhashri.
Yes, sir. Yes, madam, please.
Ma'am, I felt like parental behavior, negative attitudes towards the disabilities there, and still major support should come from the family, as well as the practiced or skilled staffs are needed to give a better rehabilitations. Then only the rehabilitation reaches us the next level. And the most important challenges still we are facing is a negative attitude towards the disability. This has been taken care by the disability awarenesses. We are giving various supports and programs, but this has to reach us a wide area. Maybe that gives us a better rehabilitation to the people who are suffering. And Mr. Santosh Khanna covered this wonderfully as a part of his presentation and highlighted how physiotherapists can make a difference in the life of the individuals to make a healthier society. I'm proud to be part of the physiotherapy profession, and that takes healthcare to the next level every day. Thank you, ma'am.
Yes. Is there any other questions? Okay, there are no other questions, so we can officially close the session. Thank you very much, sir, Dr. Santosh Khanna, sir, for readily accepting to be the speaker for today's webinar. And I personally felt like simple thing, like why do we have a mirror in the lift? Like other than ethnic purposes, it makes much difference for a person with a disability and person on a wheelchair. It makes their life much more easier in moving around in the lift or just adjusting themselves in the lift. That was really a touching point for me. Like, I'm really very happy to know many things today as a layman, even though in a medical profession, like for us, the physiotherapy will be out of our subject, and I really learned what is the purpose of the ramp and how it should be, especially grasp bars. You said about the grasp bars. Not necessarily a person should be physically disabled or anything. Even as we age, we also get the support of the grasp bars in our routine. Like when our elders are there at home, we generally tend to put all those things in place to make their life comfortable. That we are seeing at the practically in our own home. So that was really very nice point for me. Like we can correlate. Thank you very much, sir. It was very nice presentation, and we will have another session for physiotherapy separately after a few weeks. Thank you very much, sir. Thank you, madam, for Shubhashri, madam, and thank you,
ma'am, and thanks for the opportunity.
Sendal Kumar, sir, for your valuable inputs.
Thanks a lot, ma'am.